Hello, everyone. Welcome to our live session at the Norn Way tonight. We're very excited to be here, and we are very excited indeed to bring to you our guest for tonight, our guest speaker Dr. Ali Jawaid. Just to introduce him briefly, he's joining us from Warsaw, Poland at the moment. He is a MD, PhD with training in both basic and clinical neuroscience. Also a joint professor at the University of Texas, USA, and at the Center of EMPBD, Warsaw, Poland. He's an alumnus of AKU. Dr. Ali Jawaid, very, very warm welcome to you. Welcome to our show. We're very happy to have you. First of all, please go ahead and introduce yourself. And do tell our viewers what ENPBD stands for as well, since you're at the center of that at Warsaw, Poland.
Thanks a lot, Sana. And thanks for the gracious introduction. So actually you defined practically where I'm based and what I'm doing. I will just go a little bit into the specifics of what I do research on. And that will also explain to you the abbreviation so I'm working on neuropsychiatric disorders and neurodegenerative disorders. So when we say neuropsychiatric disorders, they are disorders which are at the basis, they're overlapping between neurology and psychiatry. For example, dementia, for example, PTSD, post-traumatic stress disorder, and specifically we focus on childhood trauma. And then we see whether childhood trauma is leading to, an increase in neuropsychiatric pathologies in the adulthood, and most importantly, whether these risks, whether there's susceptibility, can also be passed on across generations. At the same time, we are generally looking at the interactions of brain with the environment. So how, early life development, how certain diets, inflammations, different infections, how they alter the processes in the brain at the molecular level and then increase or decrease the risk of these neuropsychiatric illnesses. So that is generally the scope. And actually, my work, what we'll discuss today about the mental health aspect of COVID, it actually started, I would say very coincidentally, because when COVID happened, and in the beginning, when it was just in China, I think it wasn't taken that seriously at that time. But eventually, when it became a pandemic and started affecting people at a global level, we actually realized that it has become sort of a unanimous trauma for everyone. And similar to how childhood trauma can lead to neuropsychiatric manifestations, we started observing that mental health started to get affected at a very massive scale also by COVID. And that is when we started these studies to look at the specific factors which can increase the susceptibility to be affected from either COVID-19 itself or the peripheral effects of the pandemic. And similarly, if there are any factors which can increase your resilience against it, any factors which can protect against the detrimental effects of the pandemic. So that's what we are currently working on. And then one last topic which we'll discuss is the post-COVID brain fog. So because we also work on the adaptations at the behavioral level in terms of learning and memory, that is another focus for us to see if, again, COVID itself or the immune reaction to it or any other factors associated with the pandemic are leading to this cognitive impairment after COVID, which we call as post-COVID brain fog.
Right. That's indeed very extensive kind of research that you're doing, and very, very impressive. For our viewers who are joining us, and those of you, you would be happy to know that Dr. Ali Jawaid has also been on TEDx, and he's talked about his research regarding genetics and epigenetics. So please do also watch that. So Dr. Ali, since we are, on the topic of COVID-19, the pandemic mainly, I'm sure a lot of people have a lot of questions for you. So we're just going to ask you a couple of questions. You have pretty much covered the challenges that come with it briefly. So Dr. Hafza, you had the first questions.
Dr. Ali, I would like you to tell our audience exactly what you found out about the mental health impact of COVID-19 pandemic on everyone at large, the scientific observations that you've made.
Mhm. Yeah, so we did a pretty extensive study. We started back in March last year, and then it was done at a global level with 12 featured countries. So we had assessments, which were done in Pakistan, and Canada, and USA, and Iran, and Bosnia, in Italy, like different countries. We had a very dedicated team of study coordinators, and eventually we screened around 14,000 individuals, and we looked at whether we see an increase in like stress symptoms and general psychological disturbance and depression symptoms, and also if we see symptoms which are indicative of PTSD. And like the first finding which we had was that unanimously, so there were minor differences between different countries, but overall, in every country, at least 1/3 of the population we screened was impacted by the effects of the pandemic. Now, this is something which we saw in the first wave, so that was already last year in March. And then, we also identified some of the factors which make you more vulnerable to be affected. And the most prominent one was actually, female gender. And the second one was having a history of pre-existing mental illness. So we saw that people who already, let's say, had suffered from depression or anxiety or like some other mental ailment, they were being affected the most. Now, of course, you could also think about that these are also the people who rely a lot on social support. And, they are also more susceptible to effects of any traumatic or stressful event. So definitely this population was affected more. And similarly, like I mentioned, we saw that more women were affected by that. Now that could come, the underlying reason of that could be, like far and wide. It could also be that, because of the lockdowns, there were also reports of increase in domestic violence, more like caregiver burden. There is definitely an element of susceptibility to be affected by depression and PTSD in women. So we definitely found that this population was affected. Then there were some other factors which were not related, let's say, to the demographics, but more related to the attitude of the participants. That we found out that the participants, for example, who were not satisfied with the actions of their government or their employer, were more likely to be psychologically impacted by the pandemic. Similarly, we found out that introvert people actually were also more affected. Now, again, you have to be intuitively aware of this, that one would think that, okay, there was a decrease in social interactions, so maybe introverts will be less affected. But then one could also think that introverts who rely on this minimal social interaction were now not getting that anymore. Yeah. This was another vulnerable group.
It's interesting when you spoke about the vulnerable groups, and I can, just to add to the conversation, I can relate it personally to it because I've had COVID as well a couple of months back in the winter, when you said that it's women are more sort of vulnerable to it, and perhaps the reason that you gave, I think, would definitely be contributing to them. So, for example, more sort of, caregiving burdens and demographics and whatever the nuances are. But from my personal experience, I just want to share that I did read your research regarding the fact that COVID-19 tends to exacerbate mental conditions of people who are already suffering from neuropsychiatric disorders. But for me personally, that was it was sort of a discovery for me, because at least what I'd known of myself, wasn't really suffering from any issue. But once I contracted COVID in quarantine and post-COVID, I suffered a lot of anxiety. I suffered panic attacks. I suffered a lot of sort of a sense of disconnection with the world. and it really disturbed me deeply. And I'm sure a lot of people who are watching this and you're viewing this, and for a lot of people, women and men, they must have gone through the same, because, like you said, being isolated and being cut off from the world, as it is when you're in a situation of a lockdown, a pandemic, there's this lurking fear anyway that's been around because of social media, what you read, what you hear about people suffering, and then being isolated. So it's interesting that you bring that up, and that's going to be very informative for our viewers. I want to get to the part where post-COVID. So this is during COVID, the vulnerable populations and the mental health aspect of it. Physical aspect, we do know. We all are very much aware of it. But I feel like there should be more light, which you did kindly put right now. More light should be shed on the mental health aspect of it, especially post-COVID. So people who are watching, and I know friends of mine as well, couple of friends of mine had COVID at the same time that I did. A lot of us kind of went back. I mean, I'm not an introverted person at all. In fact, I think I'm very much extroverted to some extent, not completely. So the sense of isolation for me was being cut off from the world was very disalarming. But the advice that you want to give to these people who struggle mentally post-COVID, who are struggling with depression, who are struggling with anxiety, with panic attacks, with a sense of loss of connectivity, struggling to come back to their jobs, struggling to come back to children as mothers, as parents, as fathers. What advice do you want to give to them? Do you want to advise them to reach out for professional help? You want to advise them to get more support socially?
Yeah. So actually, you give very holistic point of view about that. I think which is fantastic. So I'll just mention here that the studies, we were looking at effects of the pandemic, right? That covers multiple factors, not only the disease itself, but also living through the lockdown, being paranoid about what's happening, being afraid of what might happen, let's say, to your parents, your grandparents, and then also there are consequences which, of the pandemic at the socioeconomic level, right? I mean, a lot of people lost their jobs. So there is a multitude of factors which are contributing to the mental health impact of the pandemic itself. Now, when we go into the population, of individuals who already have COVID, then what we see generally is this, what we call this post-COVID brain fog. Now that is we can call it a syndrome with multiple manifestations. So not only things happening at the behavioral level, but also purely at the level of cognition and ability to concentrate. Now, number one is that the question which is important is people who are, let's say, more affected by the pandemic, are they more likely to also get this post-COVID brain fog? It has not been widely studied. We are trying to understand this, but I have seen a couple of studies and they did not find any association between being affected previously, suffering from a mental health condition previously, and then having post-COVID brain fog. So this is something which you were alluding to as well, that you did not have the effects during the lockdown and all that process, but you have been feeling a little bit uneasy since you got COVID. Yeah. So frankly, I actually experienced the same because I got COVID back in early Feb, and I'm still struggling a little bit from these post-COVID brain fog symptoms. So what it entails is that usually people feel again, not clinically depressed, but they will have some manifestations of depression. Again, they will not have let's say a lot of panic attacks to qualify for having panic disorder, but they would have enough baseline anxiety to make their life uncomfortable. They have problems with forgetfulness, with recalling names. If they are phasing out, if they're writing something, they would get short of words. So these are all the things which are happening in a lot of patients after COVID. There are one or two associations, which have been found out, and then I can also talk about the study which we are doing. So what has already been reported is that there is definitely an element of how traumatizing having COVID was for the patient. And they've seen that the patients who were not who were affected like in isolation, who got COVID and none of the other family members were affected, we see like a little less brain fog symptoms in them. But those who got infected and then ended up infecting someone else, we see more. So I think there is definitely an element of feeling the trauma and also feeling, the guilt of possibly infecting someone, and that is associating with these brain fog symptoms later on. But that is all what is known about it. Another thing at the physical level which is known about brain fog is that patients who are still experiencing any physical symptoms, for example, who still have body aches and pains, they're also more likely to get this post-COVID brain fog. And in the clinical field, there is like an entity called chronic fatigue syndrome, in which patients feel like fatigued physically and mentally all the time. And we see that this post-COVID brain fog is very similar to that. So there definitely seems to be also an element of like inflammation. I can also talk about the study which we are doing about it. But maybe first if you have the follow-up question, and then we can get back to our study.
Sure. Dr. Reddy, I'd like to ask you something, given the fact that I greatly suffered, I feel, from what you're describing as post-COVID brain fog. My entire family was affected, and we were all in quarantine together, and it was a very traumatizing experience completely. I was on to certain big projects that I was very focused on before that, but pretty much after it, I've been having a lot of difficulty trying to get my focus together. There's definitely a bit of confusion there, and it's taking a lot of time to get back in the game. I have two questions from you. Number one, has this been decided as to whether post-COVID brain fog is due to the disease itself or the experience that comes with the disease? And also, what are the resilience factors, and how can we vulnerable populations become a little more resilient to these effects that COVID brings mentally?
Mm-hmm. Yeah, again, great question. So the first question actually, is also relevant to the study which we are launching about post-COVID brain fog. So what we are trying to understand is that whether there are any demographic factors which make you more vulnerable to be affected by brain fog. For example, does it have to do again with certain ethnicities? Does it have to do with how old you are? If there any involvement of gender and all those factors. Then the second point is whether it is related to any disease parameters. For example, the people who have a loss of taste, are they more likely to get post-COVID brain fog? Or the people who had higher inflammatory markers like CRP, are they more likely to get brain fog? The third thing which we are trying to ascertain is whether it has to do with the experiences, whether it's more related to the perception, the psychological perception, how traumatic was having COVID for you? Is there a sense of, okay, I might have infected someone else because of that? Is it related to, what we call survivor's guilt, that you were not affected so much, but someone else you knew was affected more? So there are different elements related to it, which we are actually trying to study right now. So I would say that in a few months, we would know a lot more about it. But at the molecular level, what's happening inside the brain, we have a couple of potential pathways which we think are affected. So one is I talked about this chronic fatigue syndrome. And in chronic fatigue syndrome, what we have is an element of systemic inflammation. And then that leads to activation of these immune cells, microglia in the brain. So we actually think that in this post-COVID syndrome, we have activation of these immune cells, these inflammatory cells in the brain, which is causing that. Secondly, activation of these specialized immune cells in the brain, as well as the stress. It can lead to activation of certain memory inhibitors in the brain, So there are certain memory inhibitors which are naturally present in the brain, because, for example, they have a very strong evolutionary purpose, because we are constantly, hearing a lot of things, but some are important for us, so we register those. and the others are not important for us, so we forget those, right? So there is a constant interplay between memory promoters and memory inhibitors in the brain. So what we think is happening is that due to this inflammation after the virus, and like the other possibility is the stress, it is leading to activation of these memory inhibitors, which are then causing these brain fog symptoms overall. Now, what could we do to, like, lessen it? Again, like, we are understanding it more, so we are not there yet where we can give like a conclusive opinion about that. But I could mention like a few things which are safe and which can be used, which have been previously used in chronic fatigue syndrome and are actually efficient. So one is omega-3 supplementation. We definitely know that omega-3 supplementation is enhancing, the concentration span. It is helping with registration, with consolidation of short-term memories. So the omega-3 definitely will help in, let's say this fatigability factor, and definitely this short-term memory loss, the forgetfulness factor of it. I'm actually taking omega-3 myself, and I have definitely noticed like, a gradual improvement. So that is something which can be done. Another like a safe actually modality which can be used is what we call multimodality stimulation. So you actually try to activate different cognitive parts of the brain at the same time. There are two ways of doing that. One is actually like, you guys might find it funny, but it's actually, we've all played this game of snakes and ladders, So actually that's a very good exercise, for brain fog, because it is like, it has an element of, concentrating on the game, reward and punishment, visuospatial navigation, you have to climb up the ladder and go down, and little bit of counting as well. So actually it's a very good like mind exercise, and we know that it is helping people in dementia and definitely helping people with this brain fog as well. The third thing which is potentially beneficial is it's a herbal treatment called Bacopa, which we, again, like, I use it in patients with dementia. I use it in patients, with.
Can you repeat that name again? Sorry, I didn't get that.
It's called Bacopa. Like, it's actually like an herb which you can get it from.
Do you mind spelling it out for me and for some of our viewers like me who
yes,
didn't?
It's Bacopa. Bacopa.
Bacopa. So this is an herb, yeah? So this is an herbal treatment.
This is a herbal treatment, and again, like, right now I'm only mentioning the treatments which we know are totally safe and potentially effective. And this is something, which would enhance, again, like, the concentration span, make you more like, like it will stimulate the brain, and then also help in these forgetfulness symptoms. So these are the three things which.
Yes. Since you mentioned Bacopa, just curious, are there supplements available? Should you take them as supplements? I mean, should you have a herb hunting expedition? Like, how do you take them?
No, these are supplements available actually.
I mean, let's.
Herb hunting sounds good too, but these are their supplements which are available.
For that, you'll have to book a holiday somewhere in South Asia, I'm imagining.
Absolutely.
Southeast Asia. Yeah.
So
all right. Since you
brought
up post-COVID fog and Hamza, I mean, I'm really glad you asked those questions. There is another factor to it, and I mean, since most of us have had COVID, I remember being very sleep deprived, and I remember suffering from extreme insomnia. I remember the first 10 days I just did not sleep, and I would just spend my night staring at the ceiling. And Dr. Hafza, you mentioned your one of your family members went through it as well, and a lot of people I know suffer from insane kind of insomnia. And does that lead to that must contribute to the mental deterioration aspect? Because I know that when I was sleep deprived after the 10th day, I had to beg my doctor to give me something to help me with sleep, and I literally felt like I was going to start losing my mind. So what do you have to say about the part where one can treat the insomnia? Any tips for that?
Yeah, so I mean, again, like a very important question, but I'd be very careful in answering that because, again, like, most of the hypnotics which, which are used routinely, they can be quite addictive.
Yes.
So we have to first understand, like, whether, where is this insomnia coming from? Is it because, for example, there are two ways we look at insomnia clinically. If you have problems falling asleep, then it's a manifestation of anxiety. And if you are able to fall asleep, but then you end up waking earlier than usual, we call it early morning awakening, and you're still feeling very tired, then it's a manifestation of depression, And we kind of, again, I don't have statistics to show which one is more, but I believe both, they're both, people are experiencing both during the pandemic as well as, after contracting COVID. So depending on which pattern of insomnia you have, I think you have to work on the underlying factors. If you're suffering from anxiety, then I think that is what needs to be treated and looked into. If it is more a manifestation of depression, then that is what needs to be looked into. And for that, of course, you have to consult professionals. Now, but at the same time, if let's say you think that your sleep disturbance is contributing to these brain fog symptoms after all, then definitely, maintaining a good sleep hygiene, avoiding caffeine in the evenings, making sure that we're not distracted by any sort of electronic gadgets before you fall asleep. I think those things are actually quite helpful. Now, if still you keep on experiencing this insomnia, then I would say something which is much safer than any of the other hypnotics is actually trying melatonin, very low dose, 1 milligram. It can be combined with magnesium B6, and actually that is something which is quite effective. And again, the safest way to treat sleep issues. Actually, most of the physicians are also starting with that now. Previously a few years ago, there was this, they were using the Z drugs, the benzodiazepines, etc. But now most of the physicians actually at the first line, they would start with melatonin. Now melatonin actually is available over the counter and in low doses. And I think that combination with vitamin B6 and magnesium can be quite helpful. But again, most importantly, identify the underlying reason. Is it anxiety? Is it more due to being depressed? Or is it just something which is an element of being stressed and not following a daily routine? I mean, I think the underlying factors need to be established first.
Absolutely. So that's a very helpful tip that you gave over there. How to go about treating several issues that entail post-COVID recovery or during COVID. And to just summarize it, you said the usage of omega-3 supplements, multimodality activation, playing any kind of brain-challenging games, an herbal treatment that involves the use of bacopa, and then for insomnia, melatonin and magnesium B6, the combination of these. Now, moving on to the next question, that this is something that I found really interesting, and I found it really interesting before I got COVID, when I was obviously, you're just fascinated and you're very sort of fearful and you're intrigued to find out what really causes it, what are the, sort of propagating factors. And then, of course, come myths around COVID, right? A lot of people have several myths as to why you get COVID. And especially, I think what I found most interesting was regarding the treatments of COVID. And I remember the other day on Instagram, you were talking about CBD oil and the usage of CBD, and you were breaking that myth on your Insta, where you were telling your viewers that. So please, I mean, I don't want to get into that. I want you to get into it. So what are the various myths that you've come across, the ones that you feel the need to address, because you might feel that, they're more kind of out there and people tend to actually believe them? Which ones are the ones that you want to break, myth busters?
Yes, I think also the myths have evolved, right, since the pandemic emerged. I mean, the beginning, the myths were more about whether it even exists or not, whether it is actually something which whether COVID was created by Bill Gates or whatever. All those things which I think, but they I mean, it's actually good that those myths have actually sort of faded out. They have died out as it became more clear that it is real, and it has unfortunately impacted so many people. Like I personally know many people, and it's heartbreaking to see what's going on. So I think at least some of those myths are not there anymore. But recently, like I have seen quite a few myths which like I felt the need to address. So the number one is about the vaccines and whether the vaccines are safe or not. Now there was also this whole sort of dramatic scenario in which they detected clotting disorders in individuals who got AstraZeneca vaccine. And then a couple of countries in Scandinavia, they even halted the AstraZeneca vaccination. Now again, I think the number one thing which I want to highlight is that scientists are very objective people, and we always like to state the data and everything in the most objective way, but without realizing that the world actually goes about sellability and marketing and So for example, when they talk about efficacy of the vaccines, and they say that okay, Pfizer is between 91 to 95%, and then Sinopharm is a bit less, and then AstraZeneca could be between 65 to 75%. Now we are talking about the possibility of developing the disease after exposure, right? Now again, one thing which has I think not been highlighted enough is that all vaccines, including AstraZeneca, are preventing deaths after vaccination, 99 to 100%. And again, this is something which I think this fact was not highlighted enough. And perhaps as scientists, as physicians, this is something which we need to highlight, that all vaccines will protect against a serious disease. And in the end, that's what we want, right? I mean, of course, having COVID is definitely it's an exhausting, painful scenario. But again, what we want to prevent is this mortality. So number one, this is something which I cannot emphasize enough. Now going into the side effects of different vaccines. So a lot of people are saying that, okay, we take the vaccine and then you get fever and body aches. So it is basically like getting COVID. It definitely is not the same. And actually, you should have, especially after the second dose, some kind of a reaction, with whether it's mild fever or body aches and pains, that will be there because that shows that your immune system is getting activated. It has been primed against the virus. It is responding to it, and next time when someone will get the virus, then the immune system will fight it off because these antibodies, they keep on amplifying during this time. So again, the side effects are not necessarily bad, these mild side effects which you get. Thirdly, when we go into the serious side effects of AstraZeneca, so yes, there were some incidences of clotting disorders, but if we look at the population which was vaccinated and the number of cases where there were clotting disorders, we'll actually find out that the risk is 1 in 150,000. So 1 in their luck, to emphasize, I think that's really not a high risk.
That's really minuscule. That's almost
exactly.
Very minimal. And that would be the side effect with any drug, with any medicine. I mean, if you pick up
the side effect of taking an antibiotic would be much worse than that. And remember, in the beginning, lots of people were just taking hydroxychloroquine.
Yes.
So the side effect ko nahi dekh raha tha, but then it's about vaccines that people try to really.
Body. I mean, since you brought that up, talk about that, the use of hydroxychloroquine. I mean, isn't even because I remember in the first wave and when there was news when Donald Trump was still the president of USA, and there were news going around about how he had used it and all of that. So what about, because I know in Pakistan people are still as a preventive measure using it and buying that drug. What do you have to say about that?
It is neither preventive nor therapeutic. It has no No
It's just a
antiviral activity.
placebo? Is it just a placebo effect or something like that?
I mean, again, like I would say that, taking omega-3 or vitamin C and vitamin D is definitely going to be way more beneficial than taking hydroxychloroquine, which in combination with azithromycin, which people are often taking this combination, is actually quite risky, especially in people with thyroid.
That comes under the name as Azomax, is that right?
Azomax, yeah. So like again, like a lot of people are taking this combination. Now, definitely the combination can be quite risky. Now, azithromycin itself can protect against secondary infections, right? So, I mean, and we do know that a lot of patients with COVID, they do develop secondary bacterial pneumonia. So that can have a preventive element, to it. But definitely the combination of hydroxychloroquine and azithromycin, I don't think there is sort of any benefit actually that comes with a lot of risks. So talking about myths, one more myth, which I've heard from many people is that the vaccines are not safe in people with comorbids. If you have heart condition, diabetes, if you're really old, then vaccines will not be safe. Now, again, I think we have to look at it from this way, that vaccines will still be 100 times safer than contracting COVID in these populations. And these populations we know are suffering the most. They have the highest mortality. I mean, second variant is even affecting now a lot of younger people. So again, the vaccines, even if they might have a slightly worse side effect profile in populations with cardiovascular comorbids, they are still it's still much better than getting COVID itself. And this is something, again, which we need to highlight. Again, media, newspapers, they just state the data, the facts, without really making an interpretation of it. So again, when you say that, going back to AstraZeneca, that 30 people, they ended up in the hospital after taking AstraZeneca. It sounds really bad. But if you say that this is 30 out of 5 million, that's your answer right there.
Dr. Ali, following up on that, I just want to ask your opinion on it, that most of the people in my workplace didn't get the vaccine because they had this opinion that if we get the vaccine, we'll have developed side effects or something because it's still under trial. And you have already highlighted that point that vaccines are not doing any harm to any person, but still people have very rigid school of thoughts related to vaccines. And can you share your thoughts and opinion on it from a scientific background, that what's the importance of vaccine? I also want to add that people were saying, oh, you had Sinopharm, pani ke injection laga rahe hain. So that's what the comments were from all of the elderly and people who are working with us. So can you just shed light on that from a scientific perspective?
Right.
Yes,
so
and just
one,
sorry, I just want to add to that before you answer that. There's another thing that I read the other day, and I'm sure it's pretty much a myth, is a lot of people, and this has come up on social media, that women tend to suffer from fertility issues after getting vaccinated.
Exactly.
Or start a family, should not get the vaccine. Again, I heard from somebody saying that you can lose your eyesight if you're a cataract patient, or you could lose your sense of hearing if you are somebody who's suffering from hearing issues. All of these. So can you please go ahead and address all of these myths?
Mm-hmm. So again, I mean, most of these are actually not even true. I don't think there are any studies which have shown that vaccine could affect fertility or lead to hearing loss or eyesight issues. Not at all. I mean, vaccines, most of the studies have shown that vaccines are causing these mild side effects of muscle aches and pains, and later on, accompanied with fever. And a few studies on AstraZeneca showed these clotting disorders. But again, there is no association. This could just be clotting disorders happening irrespective of this, because the rate was much less than what we see in the general population. So number one, none of these are backed up. Ab social media, you can jo bhi aapne banana hai, aap bana sakte hain. But going back into the question of whether these vaccines were sufficiently tested or not. So I'll just state the facts. So usually whenever a new drug or a new therapy or a vaccine is launched, it undergoes these three actually phases: a phase 1 trial, a phase 2 trial, and then a phase 3 trial. Even preceding the phase 1 trial is work on models like animal models or like working on cells. Then you do a phase 1 trial in which you give it to a smaller population,
Right.
usually in hundreds, and then you check whether it's safe or not. So you are not, and that population is usually diverse, and you just establish the safety. Then you have a phase 2 trial in which you test on a larger population, up to thousands, and then you check whether it's safe, but then you also start looking into whether it's effective or not. Then number 3 is phase 3 trial, in which you give it to, the criteria is that, it's usually up to 10,000 or more people, and then you see how effective it is. And still you have reporting for safety factors, but they have already been screened out. Now, after every phase, you publish the data, it is scrutinized and everything. And of course, the whole process takes a while, right? I mean, if we did the whole conventional process, then we won't have a vaccine easily for 3 to 5 years. And we wanted a vaccine. So what they did was that they combined the phase 1 and phase 2 trial, and to speed up the process. And then the phase 3 trial, which actually shows effectiveness as well as safety, it was done multi-centric on very large populations, right? So in the end, for example, the trials of Pfizer vaccine or even Sinopharm, it's like Sinopharm, the Chinese vaccine, they tried it in China and Pakistan, UAE, in Bangladesh, in several countries, in South America. So on diverse populations, ranging up to, I don't remember exactly, but easily with more than 40,000. So the vaccines have been tested, just the process was sped up. That's the only thing. So nobody could say that they were not tested at all. They were tested. Now, what is not clear is the long-term effect of these vaccines, right? We don't know what will happen 5 years after taking the vaccine in people. We just didn't have enough time to study that, and it is not possible to study that without waiting that long. But again,
what do you mean by this? Sorry to interrupt you. When you say we don't know what's going to happen 5 years later, what you're trying to say is that there is no certification or there's no guarantee that after having the vaccine, you will certainly not get COVID again. That's what you're trying to say?
I'm not, that's a different point. What I'm saying here is that we don't know if there are any long-term side effects of taking the vaccine, right? Now, but that could not be studied, of course, because we haven't had enough time to study that, right?
Yeah.
But the vaccine which they're giving to people right now, it's actually also an ongoing assessment, right? And so far, now we know that the longest duration for somebody to have received the vaccine out of the trial is already more than 4 months, and none of the long-term side effects have been reported. And as they're reported, I think there is a lot of scrutiny in the scientific world and generally by WHO. So these things will be highlighted very soon. So that is number one. What you are saying is about the long-term effectiveness, efficacy of the vaccine. Right. Now there again, we haven't had enough time to see whether they are protecting long-term or not. But we do know that they are protecting. For example, we know about reinfection, like people who have positive IgGs. We know that they are safe for up to 8 months. And you could sort of predict the same for vaccines. Now, again, we don't need the vaccines to be protective for life. Right now, what we need is to actually get the situation in control. I mean, that is also something which is quite intuitive.
Prevent mortality. That's the ongoing
mortality, and also get the situation in control, right? I mean, we need to sort of not only flatten the curve, but also bring the disease down to a minimal level. And for that, we need vaccines. Even if they are protective for 1 year, they will still do the job, Right. And most likely, I mean, we have to consider that talking about side effects and talking about these long-term protection, the vaccines which we take as children, right? I mean, we do know that they are protecting for a much longer time.
Yeah.
Now, out of all the, let's say, viruses which are present over there, they're not similar to SARS-CoV-2, like the COVID virus. They're mostly DNA viruses. RNA viruses can adapt, they can mutate. So we can expect like a little less protection. But again, I would say that, it probably will be protecting definitely for more than a few months.
This answers a lot of question and gives clarity to the question that I asked. And most of the people, our viewers, are asking questions. I also want to add over here that people in my family and my workplace, they are saying that, oh, now you've been vaccinated, we'll watch you for quite a period of time. If nothing happens to you, we'll get vaccinated. So they're treating me as a lab rat. So the lecture the other day that I attended, like epigenetic inheritance, that you tested on the mice. So they treating me someone like that. So I'm happy to do that for them. But I am also hearing these symptoms that most of the elderly people, when they had vaccine, Sinopharm especially, people who are like 60 plus, they are getting, some are getting symptoms, some are getting no symptoms. So it just depends on the antibodies level or the immunity level, I guess, if you can shed some light on it. Like the age factor also depends.
Yeah, and also what matters is that how many similar viruses you have been exposed to, So like remember, like in the beginning, there was a lot of talk about that children are either not getting COVID or they are getting it like much less, it's much less severe in children. And one of the things is
asymptomatic. Is that a myth?
Sorry, yeah, I couldn't hear you.
The thing that I've heard about kids is that kids, even if they get it, they're always asymptomatic. They can be carriers. They will not necessarily fall ill. Is that a myth?
No, that's not a myth.
Or is that a fact?
I mean, kids are actually they are not getting severe disease and they are often staying asymptomatic. And one of the possibilities is because, they get a lot of, common cold. They get a lot of infections by other coronaviruses. And as a cross-reactivity, the antibodies which are already present are not letting SARS-CoV-2, leading to these like more prominent symptoms and effects. Secondly, their immune system is reacting differently. Like, when in adults, most of the mortality is due to the cytokine storm. It is not the virus itself. It is mainly how the immune system is reacting, which is causing mortality and severe disease. So we don't see the immune system in children reacting the same way. And again, one of the theories, and there is quite a big merit to that, is that because children are getting usually these coronaviruses more. So for their immune system, it's like, oh, it's just another coronavirus, let's deal with it. Compared to adults, where it's like, okay, it's like an alien thing, so the immune system gets hyperactivated in response.
Right. Dr. Ali, firstly, thank you very much for elaborating a very important point out there regarding vaccines. I mean, between choosing the uncertainty as to whether you live or not, one rather would go with the uncertainty of, having the cure and seeing whether you live. I mean, it's important to live in the long term than to, start following up on the after effects of everything in the long term. That would be my choice, at least. So my question to you is, and I think a person from our audience also asked, there's another concern amongst people who've had COVID, who've been through COVID, that, we've already contracted COVID, we've built the antibodies there are. Do we still need to get vaccinated? So what would you like to say to these people?
Absolutely. I mean, irrespective of whether, anyone got infected with COVID or not, they still need to get vaccinated. The way they should be vaccinated is slightly different. I don't think that people who were infected before and have positive IgGs, they necessarily require 2 doses of the vaccine. I think, 1 dose would be sufficient because, again, the immune system is already exposed, is already primed. Secondly, after the second dose, these people get slightly worse side effects, So 1 dose is sufficient in those who are already infected. But the reason why we still need to get vaccinated is because the virus is continuously evolving, and even though reinfections are rare, they do occur. So, like, we need to protect ourselves as much as possible, and the combination of natural immunity together with the vaccine, I think, will be sufficient to protect us from, any kind of exposures. So that is, yeah. I mean, even if even if somebody had already COVID, they still need at least one shot of the vaccine. So, for example, what they're doing in most of the European countries is that if you already had it, they tell you to wait for 3 months, and after that you can get the vaccine shot. So I'm actually waiting for my 3 months to be over, and then I will get it.
So basically, the advice is that if you have had COVID, you wait for 3 months until after you've contracted COVID, and then you're ready to be vaccinated, regardless of whether you've contracted COVID or not. The safest option is for you to get vaccinated, right?
Yeah, everyone should get
Very
vaccinated.
interesting that you mentioned that people who've already contracted COVID should get just one shot. So from now, I'm going to talk about Pakistan, because over here the government is vaccinating with Sinopharm, the Chinese vaccine, and there are 2 doses for that. And because it's a government and there's a protocol for that, everybody gets to be vaccinated in 2 shots. Now, you mentioned that it should be only 1 shot. So what would you have to say to us? Like, should we go for just that 1 shot of Sinopharm and not the second one?
I mean, again, like, it's not that having the second shot would put you at like a risk of something like really terrible. Just the side effect profile is a little worse. We see that those people are getting higher fever and more body aches. But again, that is not something which should deter you from receiving it.
What you're saying is, after the second, if you are somebody who has had COVID and you go for a second shot of any vaccine, right? This is regardless of Sinopharm. Yeah. The only risk is that you might end up getting more intense side effects, but that will not affect your mortality or morbidity.
No, not at all. So it's still absolutely fine. And secondly, I think the reason why most countries have adopted now to give only 1 dose to people who are already vaccinated, who already had COVID, is because this will allow them to vaccinate more people. They are not giving 2 doses to like a person, rather they will be giving that to another person, who might need it more because the immunity is not there. So I think it's something which has more to do with that, and the fact that the side effect profile is a little worse. But I mean, in Pakistan and in many actually countries, I mean, people are anyways not going enough for vaccines, So
yeah,
I mean, I think that's the मतलब यही है कि एक shot ही लगवा लो, like that's the message I would want to convey to them.
Yeah, so the message that Dr. Ali Jawaid has given very clearly and very openly and very, very in clear, blatant words is that please get vaccinated. Vaccination is the safest option. And yes, any other question that we feel like we need to answer?
This is the question, Dr. Hafsa. Can you moderate?
Sure. This is Samina Haider asking, if any elderly person after contracting COVID developed antibodies to amount of 340, would you still recommend taking a vaccine to them? I think this is pretty much what you just spoke about.
Simply put, irrespective of how much IgG levels you have, you should still go for the vaccine. And also keep like another thing in mind, that people who already got COVID, they are silent transmitters, they can potentially be silent transmitters because, let's, for example, like, my IgGs are positive, but let's say I come in contact with a person who has COVID and is symptomatic. Initially, for a few hours at least, the virus will be inside my body and it will not be harming because the antibodies will be fighting against it, but viral clearance will take definitely a few hours or even days. And during that, I can keep on transmitting it to others. So the higher the immunity, like, the more primed the immunity, the lesser are also chances of the silent transmission. So do it for yourself, but also do it for others,
For others, absolutely. Because, I mean, spreading the virus in itself is the pandemic, and it's the issue. So that's a very good point that you made there. Another question that I was looking at was, somebody asked, can you reverse the effects of long-term sleep deprivation on the brain?
That's a
Is
very
it
broad question, like long-term. I mean, first off, you should try not to have long-term sleep deprivation. Like start looking at it early. And secondly, it depends on what the effect actually is. If it is leading to, this kind of brain fog sort of symptoms and concentration deficit, etc., definitely, I think they can be reversible. But sleep deprivation can also trigger, these disease conditions like neurodegeneration. For example, sleep deprivation is also a risk factor for Alzheimer's disease. And once the brain cells start dying, then you can preserve the functionality, but we haven't found a way in which brain cells, can be replenished. So it's better to, like, let's say, treat sleep deprivation early before it starts to have its impact.
right? I think that's very well answered. Any other questions that we need
I think
to
we have
get?
covered most of the questions. So Dr. Ali was very thorough that he was explaining each and every point in detail. So most of the questions were covered. So I only flashed those questions which were not covered. So otherwise, he has answered most of the questions.
So actually,
I want to ask one more thing.
Yes, please.
There's another theory that I come across, which is people saying this is in regards to the resistance against vaccinations. A lot of people say if we've had COVID, we might probably not get reinfected, and if we get reinfected, it will probably not affect us. So when it comes to reinfections, and somebody's believes that, oh, if you're reinfected, it's not going to affect us as badly. On the other hand, what doctors had told me, for example, was the complete opposite. They said that you should look out for reinfection because reinfection can actually be worse than the first time.
Yeah, I mean, so definitely reinfection. Like I said, after so there are 2-3 things we have to consider. I mean, not everyone who got COVID developed enough antibodies. Like this is something which we have observed. Like immune systems are reacting differently in people. And there are some people who actually don't develop enough IgGs, which means that they are not really protected, to that extent. So in those people, of course, the risk of reinfection is very much there. Then even in those who do have IgGs, there is still a possibility, a small possibility, but a viable possibility of being reinfected with a mutated strain, with a new strain. Now, it may not lead to severe disease because the antibodies will still have cross-reactivity and will protect against the new strain. But again, why to even take the risk? I mean, if you have the vaccine available, just simply go for it. That's I think the way to go. Yeah.
Yes,
sorry.
please go ahead. No, please go ahead. You have to say something. Please finish it,
Yeah.
Dr. Ali.
No, I actually because you were very courageous to mention that you yourself struggled during the during COVID and also after. So I think what we can perhaps discuss, which will be very valuable for our audience, is again what kind of manifestations you have, and then I'll see if I can give any advice about specifically addressing those. If you're up for it, we can do it over the next few minutes.
Absolutely. I mean, for me, because I was already, I had an underlying comorbidity. I was asthmatic, so the disease itself affected me quite badly physically, and I felt like it really, sort of floored me. But when I came out of it after the 2-week quarantine, I realized that the manifestations of the psychological aspect of it, which is something that you are not registering because you're struggling physically against the disease and it's stressing you out. And so it's a fight and flight situation that's going on in your body where you're focused on getting the treatment, the medications, trying to finish the quarantine, trying your best to survive. But once you come out of the quarantine, the psychological manifestations of the disease start becoming more evident, perhaps because then the physical aspect of it has withered down. So for me, a number of things happened. Like I mentioned, I already started suffering during my COVID. I started suffering from extreme insomnia, and I am somebody who was struggling with sleep for a couple of years. I think it was maybe an age thing, maybe whatever stress factors. I'm a mom, so maybe because of that. So maybe I thought that exacerbated, but for me, it made me really, 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 really miserable. Then it was the panic, if I have to put it. I literally experienced panic attacks, which I've never experienced before, and there was a time for it. Now, this is an interesting thing I want to ask you since I'm on this. I would experience extreme kind of anxiety that I'd never suffered in my life at the time of the sunset. And then finally, when I reached a professional, a psychiatrist, he did tell me that when you are suffering from anxiety, it tends to get worsen in the evening. And since you're into neuroscience, you can, validate or invalidate that for me. I mean, another thing that happened to me was my ears started ringing for a couple of days, and that really threw me off. So here I thought that, and because my anxiety was so severe and something that I had not sort of faced ever before, like my family members got concerned. Like you mentioned, melatonin and these other options are much, but I actually went for hypnotics. And then they had their own rebound when I finished those off. So now in hindsight, I would have chosen, not to get onto those. So like the personal advice that I give to people is that try not getting on any kind of benzodiazepines, hypnotics. Try kind of going for the herbal side of it. But when you're suffering so much and I guess like you go for any option that'll make things good for you. And then my ears started ringing, and then I went to an ear specialist, and then he said, well, your ears are, fantastic. It's just the stress. So for me, it was a multitude of stress factors that came up psychologically and manifested themselves in such a way. And it took me a good 6 weeks to recover, to the point that I think I could say that I kind of suffered mildly from depression because I wasn't really getting in touch with my friends. My friends were trying to reach me. I wasn't really picking up calls. I was feeling very low about the overall situation. Looking back now, thank God I've recovered and things are a lot better. But I am very concerned after having been through this experience myself for everybody who goes through it. And yes, these are the manifestations that I had. I know Dr. Hafza suffered a bit as well, so maybe she could add to it.
I was sleep deprived for a bit, but more than that, I was constantly worried because everybody around me. And the thing is that my parents had it, and somewhere you as an adult do expect to take care of your parents at such an age and such a time like this. And when you have to take care of yourself, you don't have your own cup full enough to try and fill everybody else's. It was a very stressful time for me overall. All of us being completely shut out from everything else, and we're all healthcare providers, by the way, so we have very hectic routines, and then everybody else was having every other symptom, and you had to try and keep yourself together. It was a lot of mental work to try and stabilize myself. And even after coming out of it, like I said, I am having a lot of trouble trying to focus on projects, and I'm not somebody who has that much of a difficulty into having a project at hand and getting excited about it and working towards it. But that is something I'm really suffering from at the moment. And it's something I'm working towards. And it's something I'd like you to tell me and the audience as to, what we can do to, apart from the many factors that you mentioned, as to how we can perhaps prevent these things if you're going through it. Apart from that, I think the general fatigue that you mentioned is something that is absolutely consistent with it. And I have to try and give a lot of affirmations to myself to, you can get back to it. You can get back to it, to sort of try and normalize it for me as to how things used to be when I was 100%.
Yeah, thanks a lot, actually, Sana and Hafza, for sharing this, very, very courageously. So, a few things, as I mentioned, which could be helpful, with the forgetfulness, with the fatigue. But I would like to add, two more things to it. So one is that during COVID, of course, our lungs are under a lot of strain, and it is like very much advised and rightly advised to have complete bed rest, and you don't want to strain your lungs more. You don't want your oxygenation, oxygen saturations to drop. Like metabolic rate should be as minimum as possible. All of that is like very valid. But after you have recovered, you need to rehabilitate your lungs. So it's not that you keep on sticking to the bed for the next 4 weeks. Actually, what you need to do is to slowly start normalizing your physical activity, and you have to rehabilitate your lungs. That is very important. So now, because a lot of people are not doing that, what's happening is that their lungs are not able to cope with the level of activity they immediately start afterwards, or sometimes they're resting for too long and then they start the activity, and again, lungs are not coping well with it. And we all think that anxiety is something up here, but at the same time, anxiety has very strong signaling from your breathing rate, from your heart rate. If you're not able to breathe deep enough, if you're, let's say, hyperventilating, then your brain will actually keep on feeding into the cycle of anxiety and depression and fatigability. So it's again very important to also physically rehabilitate your lungs, slowly increase the activity, doing these breathing exercises. It's one is a very simple one, which again, you don't do it during COVID, but after COVID, you can start doing these breathing exercises. One, like a simple one, is that you breathe in this pattern called pattern of 8. So when you breathe in, it should be so slow that it should last 4 seconds, and then you hold your breath for 4 seconds, and then you breathe out. And that is a very good exercise to start increasing your lung capacity again. So that is something which I would like to add. The other thing is that, again, all these things like social interactions and the support system, that is very important. And I think, again, when somebody is going through this period of isolation, it itself is also affecting mental health, besides the inflammation and the virus, etc., etc. So again, you also have to rehabilitate yourself through that. And the fact that for example, the 3 of us, we got COVID and we recovered. I mean, it actually means that the immune system did its job, and now we need to do our job at the psychological level to be more empowering to each other, share our experiences with the others, and also tell people that you have to take it seriously, very seriously. But once you've had it, it's not that you will constantly be a patient. You actually can start slowly normalizing your life and getting into the routine. And with that and with the supplements, I think definitely situation can be improved. And once we know a little bit more about the underlying mechanisms, one day we might be able to even have a proper pharmacological therapy, in which post-COVID brain fog could be prevented or at least efficiently treated very quickly.
Dr. Ali, what I hear is that the lingering effects of COVID tend to last from about 6 months to a year. I was even communicated that by my doctors as well, because but looking back, and then when I spoke to, like you said, it really helps getting support, and support means that you do get in touch with people who have had a similar experience as you. It really helps, because then you realize that it's not the end of the world and that you're just going through something bad, but it's going to get better. For me, I think personally, I did panic once I got COVID, because there's an overall fear that's lurking around in our environment, and that you read into via the newspapers and the social media and your TV channels, and that fear is embedded. And depending on what kind of a human being you are, if you're very sort of connected, and if you're very sensitive, or it might affect you worse psychologically. And I found with me, I think it was definitely a very psychological phenomenon, where I panicked and made things worse for me. So just to share my 2 cents here with anybody who's watching, is that if you do have it, it's not the end of the world, and do try not panicking, because the stress worsens everything else, because you will most likely, by God's grace, survive. But speaking about the lingering effects, because some of my friends, including myself, I don't really get the body aches as such, but I do get the on and off headaches. And then I have friends who for whom it's been almost 6 months, 8 months, and they still suffer from body aches and headaches and
Joint pains also.
joint pains. So, I mean, what do you have to say about the lingering effects? Do they eventually fade away, or is there not enough study and research into that, and that's still something that needs to be studied and discovered?
So, I mean, we do know that there are, these long haulers. Like some people have these lingering effects a lot more than the others.
Yes.
And like there are like some studies which reveal like a few factors that it's more in people with pre-existing psychiatric condition, and it's more in people with inflammatory disorders. So we do know a little bit about it. But again, like we need to know a lot more to see like what are the determinants of it, and also how these people can be like affected. But again, like I think the important thing which I would like to highlight again is that you have to mentally and physically rehabilitate yourself.
Yes.
Like if you are staying like away from physical activity for too long after COVID, again from mental activity for too long after COVID, then I think it just makes it much worse. So like rehabilitate yourself, and like I think soon enough we will know a lot more about like what is determining this long hauling. I mean, again, with our study on post-COVID brain fog, I mean, we hope to eventually reach a point where even before the disease itself, like when people recover from that, we will be able to predict which people are more likely to experience it, and then we can already start them on like certain preventive modalities so that these effects can be lessened.
Dr. Ali, adding to that, you three of you shared your experience, like three of you experienced COVID. But since I didn't have COVID, but I just want to share that I've been on the front line. I've been seeing COVID positive patients, and I've been going to the COVID ward while wearing all the PPEs. And the first time I cannot explain. It was like walking into a death well. That Dr. Sana has explained that manifestation of the anxiety that media has created, like because yes, I'm a healthcare professional. It's my responsibility to look after the patients, but it was still there. And for quite like when I stepped inside, I wasn't able to breathe for like 5 minutes. So I had to take some time and to repeat this affirmation that I have the power to do everything, and that made a difference. So, but when these both were not were having the COVID symptoms, and I was also getting like anxious. So I'm thinking like it's COVID or no COVID it's affecting each and every person's mental health, regardless because of your loved ones.
These are just like general effects of the pandemic, like the fear, the paranoia, the constant negative stimulation. I mean, of course, like, for example, like again, going back to our study, the 14,000 individuals, I mean, those are effects of the pandemic, those are not necessarily effects of COVID itself. Those are just effects of like, the losing jobs, of like losing loved ones, just being like, in social isolation. And again, like in that element, I keep on emphasizing that, physical distancing should not turn into social isolation. That is something which we all need to keep on reminding ourselves, that you need to connect however you can, like, with your loved ones. I know it's very difficult, but again, that is something which we also found out in our study, that among the resilience factors, having good social support was very helpful. 15 minutes of 15 minutes of exercise per day were very helpful. Now, we are not talking about COVID patients here. We're talking about general population, that these are the resilience factors which can protect against being affected by the pandemic at the mental health level. So
this actually helped because I've been practicing this, whatever you were talking, and I actually had a vacation. So this also cleared the mental fog because I've been like to my elderly ancestors' place. So I think that also helps.
Absolutely.
I think we can vouch for this both when we had COVID and when we did not have COVID, because since we've all been at the front lines and dealing with so many patients, we were pretty anxious right from the beginning. And I'm a dentist, so I was working in very close proximity with people, and it was a lot of stress as it is. And then I finally had COVID. And in both these situations, I think the fact that we had a good support group was a very helpful thing. Like, for example, I remember talking to you, Dr. Sana, during my quarantine, and you comforting me with the experiences that you had. It really made a lot of differences. What's happening. You're a little scared, and then you hear from somebody coming from a familiar place that I've been through this, and this what happens, so this is what it is. So just being a little aware of what you're going through by somebody validating the experience for you because they've had it themselves, becoming a support person right there, I think it does make a lot of difference, and we can vouch for definitely whatever you said.
Absolutely. I would just like to add like a note of caution there. So, I mean, it's very important to have these support groups, but like, especially if you go into these support groups on Facebook, don't believe everything you read.
Yes.
Don't start using
That was important. That was important. Thank you, Dr. Ali, for mentioning it.
Yeah, like
Yes.
apple cider will not protect you, and like, I don't know, vinegar will not protect you. I mean, like, again, like I think this filtering of information is very important. And I think so. What I usually feel is that generally, like professionals, they are not always, but at least more likely than the others. They try to be more objective in their evaluation of these things. And secondly, like never take like unwarranted support from someone, like unwarranted advice. Like seek advice from the right people who actually know what they're doing. But like don't rely on these like random forwarded WhatsApp messages and these support groups, they're also like full of I don't want to use the word, but you know what I mean.
Yeah.
Invalidated advice and invalidated suggestions, and don't self-medicate as well. I think that's a very important question.
Look for emotional support rather than generally following advice, because I think that's something your physicians can do, and people who are experts at this look to each other for emotional support and connection more than following the specific advice on how they're coping with it. Besides, COVID expresses itself as pretty different for everybody. It was very different for Dr. Sana. It was kind of different for me. So I don't think one key fits all, but just to have somebody telling you that, it's going to be okay. I've been through this, and it'll be fine. It's part of the process. That I do believe makes quite a bit of difference.
Yes, absolutely. And I think in today's session, we have pretty much talked about all COVID-related queries, myths, questions, concerns, considerations. I think anything that I had in my mind, I have been able to talk about it, and so have you guys. And thank you so much, Dr. Ali, for being here with us and talking at such great length about this current pandemic, COVID-19. It's all the resilience factors, the vulnerable populations, the mental and physical aspects, and all the useful, helpful tips that you gave us. Thank you so much for being here with us and joining us tonight. I'm sure everybody who's watched, all our viewers have benefited greatly. I mean, we certainly have. And it was a pleasure to have you. We thoroughly enjoyed our conversation with you. So we will wrap up for now and hopefully get back to you guys in the coming week. So it is a very good night from the Norn Way team. Dr. Ali, if you want to give a parting message, please do. And
thanks a lot. It was definitely a privilege and a pleasure to be here. I think generally in the Norn Way, I fully support a group like that because number one, it's holistic. I mean, I see that you are expertise in different fields, and I definitely see that there is like a very high level of objectivity and like a very good interface of both physical and mental well-being combined in your initiative. So it was definitely a pleasure to talk to you guys and using the platform to try a little bit at least to increase awareness and to empower others however we can. So thanks a lot, and I hope
Thank
to see
you, Dr.
you.
Being here, and hopefully we will connect with you soon again on yet another really exciting and deeply engaging topic next time in the coming few weeks, whenever. So thank you, everyone, and thank you, Dr. Ali. Have a very good evening. Bye-bye. Signing off now.
Thank you.